All right, we are recording. Hello, everyone. Welcome. This is Alan Kopic. We're going to give just probably a minute for others to arrive. We're admitting from the waiting room now. I think everyone that's in the waiting room is now admitted. Everyone is muted. I'm just checking the list. We have a couple more in the waiting room. Hopefully you're able to hear this audio. I'll be introducing our content and our first one up to speak to you all here in just a moment. Also tell you who I am and what we're going to be doing today, why it's exciting for all of us. Okay, admitting a couple of more, 3 more. Welcome everyone as you're coming into the Zoom room. I want to welcome you. I'm admitting as fast as I see you coming. And they're just coming in.
I just sent that reminder, Alan, like, 30 seconds ago, so.
Wow, good thought, and here they come. they're just coming. Welcome again, everyone. My name is Alan Kopic. I'll be introducing and kicking us off here in just a moment. I just don't want to leave anybody in the waiting room, and they're arriving like crazy. So we're admitting. All right, our room is filling up, and we still have folks arriving. Thank you and welcome. Okay, it looks like we've had a little bit of a slowdown on the access to the waiting room, so I'm going to begin. We are just after our 2 o'clock starting time. I'll continue to monitor the waiting room to be sure that we bring people in as they arrive. All right, so my name is Alan Kopic. I'm a longtime hospital leader here in Kentucky. We are going to be talking today about a COVID testing strategy that provides reserved access to test capacity for Kentucky's hospitals, where Kentucky's hospitals get preferential priority, so that we know we can honor the requirement that we have from the governor's office that we're able to get a test result back in a specified amount of time. And so the turnaround time is critical. And it made sense to all of us, and the KHA, I believe, was completely understanding of this concept that our hospitals need to have access to testing and low short turnaround times for the results so that we can get our hospitals back to business again and begin to serve our patients. So again, my name is Alan Kopic. I've admitted several more into the room. They're still arriving, so I'm going to continue to do that. I want to turn you over to Deb Campbell. Deb is the infection preventionist for Kentucky Hospital Association. Deb is on the KHA team and works hard to support our hospitals across the board with regard to quality improvement, clinical quality, and infection control practices and policies. Deb, so glad that you've agreed to help us begin this conversation today, and I want to turn this over to you and let you introduce our Mako Medical team leaders.
Thank you, Alan, and thanks everyone for being here. I'm sure there are many of you out there that I know well and work with all the time. Since the KHA guidelines went out, the consensus statement on resuming elective procedures that was blessed by our governor's office, we published that on April 27th, as you know, and I know you've all been working very hard on your reopening plans. As I talk to you all throughout the state, among the challenges that I've heard every day is how to meet the turnaround time of the 72 to 96-hour COVID-19 testing that we need to do prior to all of our invasive procedures. And because we know that's a challenge and because we anticipated that as a challenge, we have partnered with Mako Medical Labs to help provide a solution for you. So let me introduce Ryan Nibert and Jonathan Tucker, who are partners at Mako Medical, and they control multiple states. They are both located in Charleston, West Virginia, and already are serving some areas of Kentucky, so they're familiar with us. They will be your dedicated Mako representatives as they assist each of you with your COVID-19 testing and helping you make the reality of a safe reopening of our procedures come true for you, as I know you want, and as I say, I hear from you every day about this, so I'm really happy you were able to join us and to hear from Ryan and Jonathan what they can offer. Guys?
Thank you all so much. This is Ryan Nibert, and of course Jonathan Tucker, my partner. And basically, we really wanted to speak to you all today to describe a little bit about Mako Medical as well as some of the things that we're already currently doing all over the East Coast, as you can see on the map here. So just a little bit of background on Mako Medical. So we were actually founded in West Virginia about 7 years ago by a man named Chad Price, and essentially what we had to do was we had to move the laboratory to North Carolina. So we actually have 2 labs in North Carolina because of lack of vendors. We really lacked the vendors in West Virginia. That's why we kind of moved down to the Research Triangle. That allows us to be actually about 30 minutes from LabCorp. So we have access to all of their vendors. So people are always wondering, well, how do you get such great prices on reagents, consumables? How do you have access to so many swabs? How can you guys get the testing kits and others can't? Well, we have access to that because we're right where all the vendors are. We have about 10 vendors right now that we're working with on testing kits. We're supplying states all over the country with kits. And what we really want to talk about today is actually cutting out some of our capacity, our daily capacity, just for Kentucky. So that's our initiative that Jonathan and I have been working very diligently on with the association to try to carve out a capacity, a certain amount of capacity that Mako has each day to just Kentucky. So we've listed some of the awards that we won here. 2020 Forbes, number 174, top 500 America's Best Startup Employers. So essentially, what award after award, year after year, Mako is making headlines for some of the things that we're doing. The press is acknowledging some of the wonderful, innovative initiatives that we're always doing. We've been nominated as one of the best places to work, and we right now, Jonathan and I are spending a lot of time in Kentucky. We typically control the majority of West Virginia with our time, but we have seen the need right now in Kentucky. That's why we're have essentially put ourselves out there to truly care for some of the hospitals in Kentucky because they need help just like everyone else.
And this is Jonathan Tucker from West Virginia also. Just very briefly about why Mako. Mako, we support over 400 charities every year and also 80 missionaries. We have a Mikey the Mako mascot, which goes to senior living homes, community organizations, and also local children's hospitals that kind of sits with patients before they go into surgery to kind of help calm them down. And then finally, military. There's over 600 team members on Mako's team. Over half of them are all military veterans. We do have almost every branch of service that we represent in Mako. So our entire logistics fleet, procurement team, and also supply and chain team are all United States military veterans. So typically, if you were to call into Mako and you speak to that loud voice, there's a very good chance that you're talking to a military veteran.
So this is just a quick slide about how we're a little bit different. You know, Hacking Innovation, a book by Josh Linkner, came out and spoke on some of our growth model at Mako and how we were able to be so successful. And it really comes down to thinking outside the box. You know, the majority of time with the lab industry, you know, it's kind of black and white. Lab, you know, Quest and LabCorp, they're kind of doing the same things. Well, whatever they're doing, we want to do the opposite. Whatever platform they're utilizing, we want to try to get a better one. I know that the majority of our big competitors right now are using the 7K platform by Thermo Fisher, the PCR. we're using a 12X platform, the 12K platform. So essentially what that can do is 32-fold more than their instrument. So Mako right now is operating 24 hours a day, 7 days a week. We have multiple instruments running at that time. We have dedicated staff for each state that we're working in. So essentially, with the partnership with the Kentucky hospitals, when your specimens show up to the lab, there's an instrument there waiting on you. There's a team there waiting on you. As soon as those specimens show up, they're automatically accessioned, they're automatically put on the instrument, and you have a dedicated team to work with. That's what makes us a lot different. You call some other labs right now, you're going right to voicemail. They're basically just saying on their answer machine that, hey, we're not taking phone calls right now. Well, what if you're looking for a patient result? Free right now does not always mean the best service. So one of the things that we have worked right now with, the association is to offer the test at $85 per test. So essentially what that means to you all is that you can still bill for that. So it's a client bill situation. You all are still able to bill for that. You can still capture that margin. You're still able to bill out those to commercial payers and capture the margin there. So this is a wonderful way for you all to get wonderful service, great turnaround time, dedicated individuals that work with you every single day. As we kind of see the competitive advantage here, multiple result in ordering modules. So essentially, if you want to order through our web portal, you can do that. We do integrate EMRs. Of course, that does take time. If you want to get your results faxed, you can do that. If you want to order through manual requisition form, we can do that. If you want to order through the web portal, you can also do that as well. So we want to work with you and be innovative in what makes it easiest for you. Let's streamline processes. Let's cut through the red tape that you're currently dealing with other laboratories, and let's turn this into a solution.
And just so you all kind of know, this is Jonathan. My background is healthcare administration. So, let's think about what Ryan just said as well as hospital leaders. Is if we bill you for $85 and then you can bill the patient for $150, what's your margin on that? And then if you're doing a couple hundred to a couple thousand a month, or in addition to, just think about your profitability and what you're going to be taking on. And, a lot of the hospitals in the area, they're charging $200 for this COVID test, and yet we're billing them for $85. So you can kind of see where this is going. And also with how many surgeries have been down, and how many cases that the hospitals are not being able to see because they're having to disperse employees elsewhere within the health system, it's taken a major loss and a major toll to where they're having to furlough employees. So you can certainly reap the benefits by being charged a much lower rate with Mako.
Yeah, and this slide kind of just goes into a little bit about what we spoke on so far. Access to kits found nowhere else. Essentially, like I said at the beginning of the presentation, we're utilizing about 10 vendors right now for swabs. We have no problem accessing kits. We typically can get kits overnighted. So I had some individuals reach out this morning from Massachusetts that needed some kits. I was able to help their nursing home out because we had access, and tomorrow about 10 or 11 o'clock, they'll receive those kits. So there's no red tape in getting the kits that you desire. We're hearing that a lot about laboratories. You ask for 500 and they send you 100. You have dedicated Mako team members in the lab and boots on the ground. Jonathan and I, we've taken the Kentucky initiative, and we're working very hard to help Kentucky hospitals basically achieve their goals. Direct line of communication with executives, that kind of goes right along with dedicated Mako team members. Fast turnaround time to help your local communities get back to normal. So you all have seen and know what a turnaround time of 5 or 6 days will do. Right now, we are seeing about a 24 to 36 hour turnaround time once it's been received in the lab. So a turnaround time of 5 or 6 days just will not do. Access of swabs has to be there. If you need 500 tomorrow, we need to figure out a way to make that work for you, because you have to get your communities back to work. The extraordinary circumstances of the pandemic requires hospitals to look outside the box of the current lab partners that they already have. I know a lot of you already have agreements with some of the bigger names in the industry, or some of the smaller labs, depending on where you are. But it's time for all of us to work together. We're not out there trying to essentially even compete with other companies. We know what type of service we have. We're looking at them as a partner at this point in time. If there's a chance that you have to use 3 or 4 different laboratories, that's great, but let us help you. let us be that extra side person that you can say, well, you know, our main lab gave us 500 kits and Mako can give us 500. So we have 1,000 for tomorrow. That's the option that Mako's bringing to you. So we're just trying to be a great add-on for all the hospitals.
And just to kind of add on to that, exactly what Ryan was saying, something that we're doing here in West Virginia, North Carolina, Virginia, Georgia, all the states that Mako is in, what we are doing there is we are partnering with, you know, for example, just an example on the call, Kroger Health, or we're partnering with these hospitals and these health systems, and we're going out into the community and we are providing all the testing kits. That way they can make sure that, for one, they have all the kits that they have available. And then two, it makes the hospital system look really, really good by going into these nursing homes, going to these skilled nursing facilities, going into the communities and saying, hey, we're going to help you build out drive-through testing platforms to get the community back into order. So that's something that we have been very, very focused on, laser focused. So I think that that's something that would be a huge benefit since we have a huge flux of all of these testing kits.
Yeah, and this right here, this slide's kind of just a brochure that we created, and essentially goes over, like I said before, we're utilizing the 12K Flex system, real-time PCR instrument for this test. And, you know, the majority of other labs out there, they're using the 7K. So, you know, with the 7K, you do get a great platform. It's essentially the same instrument, but with the 12K, we can do 32-fold more. So the benefits of that with turnaround time is tremendous.
And this is just a quick hospital reference from Brian Canfield. He's the COO at First Health Moore Regional Hospital. You know, Ryan may have mentioned this already. On the bottom right-hand corner, this is the validated collection kits. We use a nasal pharyngeal and an oral swab and saline and universal transport media, as well as a Copeland e-swab. And how we do that is we have been able to purchase ahead of time. We kind of forecasted that this pandemic would be much worse in America. So we were very fortunate, and we bought several 100,000 kits. So in doing so, that's allowed us to partner with many hospital systems across the nation. And actually, we just picked up a hospital system in Great Britain just this last week. So by really making sure that we have all the supplies needed.
Yeah, and this essentially is what we want to carve out for the hospitals in Kentucky. So Mako wants to reserve right now 5,000 COVID-19 tests for Kentucky. So essentially, we want to be able to say, yes, we have a commitment of 5,000 in Kentucky. We have an instrument that's basically only Kentucky's instrument. That way, when all your specimens from Kentucky hospitals are showing up, they're accessioned by a specific team. They're you know, the genetics scientist is the one analyzing your results. It's the same person every day. And then, of course, you're dealing with Jonathan and I. So you're going to have that direct access when you have questions, need additional kits, need to get in touch with someone, because like I said before, right now, trying to get anything from any laboratory, you need to have the designated person. I mean, if you need something, how long is it going to take you to get in touch with some of those smaller companies right now? So that's basically what we're trying to do right now for Kentucky. Yeah, and this is something I'm sure that they're going to send the slides out later on, but this kind of goes over just our overall scope at Mako. You know, we are a full service laboratory. We offer a ton of different services. We're doing everything like a LabCorp Quest can do. Being the research triangle, our lab director actually was with LabCorp for about 22 years before he came to Mako and ran our lab. So this kind of just shows the scope, some of our locations. Of course, like I said before, the awards kind of go on and on because we are very blessed to have a wonderful structure at Mako where people are, you know, we kind of like to think about it as Google, if you will. Some of the individuals, we encourage people to think outside the box. We encourage people to be successful, and we want new ideas, and that's how we're able to truly compete with the competition. So if you want to just kind of look over that on your own, you certainly can.
And then this right here is basically how samples should be shipped. It's a quick rundown. Samples and specimens should be shipped refrigerated if received for testing within 72 hours of collection. Room temperature if received within 24 hours. You ship something out today, it's going to get to our lab overnight. And, you know, so therefore you would not have to refrigerate it or freeze it or anything like that. So that's something that we can definitely provide to you all as well. The criteria for sample rejection is these are what it would fall under if it were to be rejected in the lab. Unacceptable specimens include those who are room temperature swabs greater than 24 hours old, refrigerated swabs that are greater than 72 hours old, and then calcium alignate tip swabs or swabs with wooden shafts. That's not something that we would suggest sending to us because it would compromise the specimen. Glass tubes, that's kind of a thing of the past, but time to time we do still get those. And then improperly labeled, contaminated, broken, or leaking transport devices.
Yeah, and this next page just kind of goes over some of our logistics teams. Like we kind of pointed out earlier, we truly give back a lot to our local communities, being a faith-based company. You know, about half of our organization are military veterans or serving right now in the reserve. So we always like to kind of point out our entire logistics team's 100% military veterans. So you know that with our team, when they're stating what time they're going to come to pick something up, they're dead on. These guys are amazing. You know, if you can run logistics in Iraq and Afghanistan, running logistics is pretty easy when you come back to the States.
Then you see right here where my hand is, that is a former commanding officer of the United States Army. Very young, but he moved up through the ranks very, very quickly through the Army. And then the COVID crisis is not about testing capacity, but it's about combining capacity with coordination. So we kind of want to make it a one-stop shop for you all. You all have a problem. Okay, we're going to bring you a solution to your problem. So we conquer COVID with coordination and capacity. And this is a picture of one of our lab techs in our lab.
So thank you all for listening to our presentation. I know it seems like a lot of information all at once, but we wanted to kind of run through, you know, what Mako Medical is, what we're all about, where we're located, and, you know, we would certainly love to talk further about our relationship with each and every one of you. And we feel very confident that we can assist you during this crisis and help you achieve your goals.
Hey guys, this is Alan. I just want to start with the questioning time and invite any of the participants who have a question to use the chat box at the bottom of your screen. Just click the chat button, and then you'll be able to type in a question for the fellas here. Deb, I'm sure you're going to have a question or two. I just want to prime the pump for questions and ask you guys to share a little bit about your logistics capacity. So once hospitals are aware of this reserve testing capacity for COVID and begin to say, yes, we want a certain number of tests, please deliver the kits. Just talk about the implementation process, if you would. And then once we get close to that reserved allotment, how can you then roll out a really robust logistics system that is really going to meet the needs of the hospitals and get our turnaround times down to, you know, as low as possible?
Yeah, you know, that's the goal. It's always the goal, Mako, and that's why we love having logistics. We don't like to really FedEx anything typically. So our goal is to clearly have logistics out throughout Kentucky. We currently right now are in some of the northern parts of Kentucky that are pretty close to the West Virginia border. So we do have some stuff down in like Prestonsburg, Ashland, Louisa, and a few other sites. So right now, you know, I know that this slide does say that we reserve about 5,000, but we can actually take that up to about 10,000 a day. So if you were in a position where like, well, 5,000 doesn't seem like that's a lot, well, we could actually move that up to 10,000. We just didn't want to stick a number in there and make it seem like we're asking for too much. But how it would essentially work in the beginning, some sites would have to FedEx. We provide all the FedEx bags and labels, and their FedEx, they typically get to our lab next day about 9 or 10 o'clock in the morning, and those would be automatically accessioned. So even if they were driven directly from our routes that are built out in West Virginia, if they were picked up in Kentucky and driven down, they typically get there about 3 a.m. So if anything, they're about 6 or 7 hours behind. So our goal is to cut that out and drive everything down. So we would slowly build out the routes kind of based on the need of the Kentucky hospitals. But for us, we know it takes a lot off of you. If a driver can just come and pick it up, you don't have to worry about any of that. So that's our goal. But that clearly depends a lot on interest. I know some of you, that might be kind of in areas where we already are, kind of Pikeville area. We have a location there as well. There might be an opportunity at that point in time where, it's just picked up on the route very easy. But for some of you, maybe down in like the Indiana border area, they would have to FedEx until that can be completely built out. But that is certainly our goal. We don't foresee this going away. It's great to be optimistic and think in a couple months we'll be back to normal, but we do foresee testing being needed for at least another year.
Excellent. All right, we have a couple of questions already in the chat box. I'll invite again any participants who have questions to please enter your question into the chat box, and we'll try to handle every question that is entered. Guys, can you discuss the steps to getting signed up to access a portion of that dedicated or reserved capacity with Mako?
Sure. If you all just want to send Jonathan or I an email, and I'm sure that Deb and Pam or Alan can send that out to the group and send out our contact information, and we can move this along very quickly. We'll send you an agreement, and essentially that can be looked over. It's very straightforward. I'm sure you guys have seen many of them with laboratory agreements from other labs. And then essentially what we do from there is as soon as that agreement is signed, we send out the swabs that same day. So let's say today, you're looking to get signed up. I can get an agreement probably tonight, get that over to you tomorrow. I can get the swabs sent out, and you'll get those next day. So we can move the process very quickly. It seems complicated, but we have cut through a lot of the red tape. Like I said, we can make this very easy. So that's why we've dedicated ourselves to be the main point of contact for everything for Kentucky.
Okay, I'm going to ask
Ryan.
Go ahead, Deb.
Excuse me, I was just going to say, Brian, your email address is on the invitation to this webinar. It's also
Great.
in our update for KHA yesterday and today, day before, and Pam has also put information in the chat box.
Great.
Sorry to interrupt you.
Yeah, and I'm so glad you said that. And what would help us is, we want to streamline everything. So in that initial email, if you don't mind providing like the hospital name, like legal entity name that would actually go on agreement, as well as the address, the actual physical address. And that way, if you're looking to see an agreement, I'm getting that a lot where there's just like, hey, send me an agreement, I can look it over. That's what I need to put on the agreement. And that way I can make it correct from our legal standpoint and get that over to you ASAP.
Excellent. Just a quick question about the agreement itself. Guys, if the hospital is part of a system and there's a lengthy legal review that has to happen with every new agreement, if that's the case and they already have a legal framework that has been set up for a previous laboratory agreement, are you all able to use their already approved legal framework to review and then execute so that we can expedite?
Certainly. If you have an agreement that's already been approved by your legal team, we would prefer that as well. Like I mentioned before, it's $85 a specimen. So if you want to put that in the agreement, and we can just get that signed off on as long as we agree to the terms with our legal team.
Excellent. Another question from the chat room, and please, continue to enter questions that you have. So is a commitment required for designated number per day by any hospital or system in order to use a portion of this reserved capacity with Mako?
There is not. Our overall goal is to be committed to the state. So there's not a requirement. I know we've already had some inquiries already by some sites that want to send us about 10 or 15 a day, and that's completely fine as well.
Okay. And then the chat box has Ryan's phone number, his direct phone number in it. Amy, could you add his email address to the chat box as well, just so that everyone can get it right out of the chat box? Another question.
There.
Oh, excellent. Yep, there it is. I see it. Thank you all. Another question, does the hospital have the option for Mako to bill the patient's insurance or to bill the hospital for the testing?
So we can also do that, but it's one of those things that would have to be essentially in the agreement. If you would like us to do all of the billing, that would require for us to get all of the patient information, which I'm sure you're used to, no problem. You're just going to complete a Mako rec form that you have to do anyways, and you just staple essentially the patient's demographic page to it. So the patient in insurance, card as well as driver's license, and we can certainly do that. And if you have any patient that doesn't have insurance at all, and it's going to be a self-pay patient, I don't know exactly how each system is dealing with that. We could do a client bill situational no's. If you're able to get reimbursed from the state or from the feds for those, we can also do, we can piecemeal it. It can be all client bill, meaning we bill you. It can be partial client bill and insurance where we bill the insurance. We can piecemeal it to each deal.
All right. Okay, we're just waiting for any additional questions. Deb, do you have any questions or thoughts when you put yourself in the shoes of all of the different hospital leaders you work with across the state on things that they may be concerned about or may want to know?
Yes, thanks for asking me that. I just received a question privately, and I've heard this question multiple times since we started talking about this. If a hospital is already using another lab, but they need more capacity, or they want to take advantage of a faster turnaround time, or there's some reason that's not an issue, right? That's
No.
something I would assume you would welcome. And I know that many of the hospitals have told me, we actually are testing with X company, but as they are ramping up procedures, I think there is a concern that there's going to be either, number one, just pure capacity issue, and second of all, that the lab will accept the specimen, but it will then get into a longer queue, and the turnaround time will just continue to get longer, because unlike your guarantee of only accepting as many tests as you can run within your time frame, not everyone has that guarantee. Does that
It
question
completely
make
makes sense, certainly, and especially with your big two right now, Quest and LabCorp, with the amount of specimens that they're receiving all over the country, there's no way for them to prioritize any state, individual person. It doesn't matter. They're accessioned as when they're received. If they got 300,000 sitting in the fridge ready to run, that's what it's going to be. So we're in a position where plenty of labs can play right now. Our goal right now is to help you and assist. If you have a lab that you're using, we're not trying to step on that relationship. Just utilize us for what you need help with. That's no problem at all.
Excellent. Guys, could you talk briefly about how the hospital could become the testing hub for its community, and how kind of you've seen that in other places in the country, how that might work, and how the hospital could turn that into a revenue stream, as well as just being the resource for their nursing homes, their employers, their private physician practices, the FQHCs, the RHCs, the home health agencies. So the hospital as a testing hub for their community. Can you talk about how this might work and be able to really give them the confidence they can move forward with a strategy like that?
Certainly, Alan. And this is Jonathan. And one of the things that I used to do at the level 1 trauma center that I used to work at was we had a command center, and we had a contingency plan for this command center. So within this command center, we had different people from different markets within the community, skilled nursing facilities, daycares in case something happened and children need to be watched during a disaster, multiple entities. There are many, many, many plants that are in Kentucky that need to get back to work as well, or at least need to have all of their workforce brought back. The revenue source that you all could utilize through Mako is bill those businesses and have those people come to do testing at mobile testing sites at each one of your locations. You can utilize our low price point, and then you can build a higher threshold, say $200 again, which is what we're seeing here locally in West Virginia. And then, you're making a profit of $115 basically just to stand there while we're doing all the work. We're shipping it, we're running the test, and we're sending you back the results. All you have to do is just do the collection and then make the money off of it as well. That's a huge resource for you all to really benefit from financially. But also go into these nursing homes and these skilled nursing facilities with our testing kits and utilize that to bring all their employees back to work. That's what we're doing right now in Massachusetts and in Texas and Florida. We're testing all of the nursing homes and skilled nursing facilities and their employees. And we're bringing all of these people back to work and ensuring that the families, that they have 2 negatives after a positive. So that's another way that you all could really benefit the community, to show them, hey, we're all in during this time.
Excellent. And just a clarification, are there costs associated with signing the agreement? When does a cost show up to the hospital? At the agreement point or at the point of a request for test kits?
I'm sorry, hold on one second, Alan. I think it was based upon request.
So essentially, sorry, I got some water there. So essentially, it's going to be based on when they're received by the hospital.
Okay, wonderful. And so there's no cost to sign the agreement or review the agreement. It's only after the agreement's in place and the hospital says we need 75 test kits, or we need 750 test kits, or we need 7,500 test kits, whatever. That's when the kits are shipped, and then an invoice follows the kits. Is that correct?
Exactly. So essentially, if somebody reached out, they're like, hey, we need 5,000 kits. Great. We're going to ship 5,000 out to you. Once it's been proven that they've been received, you will be invoiced for those 5,000 kits.
Excellent. And then the cost, again, the $85 price point per test includes, what does it include?
It includes everything. So that includes the kit. It includes logistics. If it's FedEx, it's going to include the bags, the overnight labels, the sessioning of the specimen, everything. So for $85, you get everything.
Okay. Go ahead, Deb.
Sorry, this is Deb. I just wanted to kind of bring up, as I now recognize some folks that are on the call. As we've started this ramp up, there has been kind of a slow, naturally, everybody's so busy, understanding of this turnaround time. So I just want to make sure everybody on the call is aware of the reason that we are feeling this sense of urgency is the guidance, which specifically states that the COVID test specimen has to be, collected. So the test has to be done within a window of 72 to 96 hours. So preferably 72 hours prior to the procedure itself. And if it can be stretched to 96 if the patient will agree to self-isolate. But that is something that we have not had to deal with prior to, literally, today. So because that's when we could start doing these invasive procedures. So it's something that I think we're all now trying to figure out when that hits everybody's understanding, and when everybody starts to get in compliance with that and starts to have more and more folks feeling comfortable coming back for these tests, we know this is going to change the situation. I mean, it's going to change what the number of tests going to labs looks like. And so just bear in mind that as I talk to people, even if you feel comfortable now with what's happening, knowing about options for increasing how many tests you can run per day is going to become, I think, increasingly important. And remember, on the 13th, then we go to doing 50% of our inpatients. So then that's even another large number. And I think we all believe that our patients will become increasingly comfortable with coming back to the hospital for things. So this is going to continue to ramp up over the next period of time. So getting ahead of the curve is what we were hoping to help you do by partnering with Mako. So I just thought I'd mention that because we have seen that that's something that's just kind of coming to people. And so we want to make sure everybody understands why we were feeling a sense of urgency.
Excellent, Deb, thank you. There was another question in the chat box related to the HCPC code or CPT code for the COVID test performed at Mako. The answers are right there. Ryan, are you putting those in, or is that somebody on your team?
Jonathan is. Yes, sir. Okay. Jonathan's typing them in as we talk.
Excellent. So anything you want to cover about the specific codes, or if somebody's not able to see the chat box, can you just tell them what those codes are so they can copy them down?
Yeah, certainly. So the 720-100, that is the COVID-19 SARS-CoV-2. That's the PCR test. So that's what we're going to be running it on. And then the other is just the COVID-19 DX codes. The Z03.818, that is the encounter for observation for suspected exposure to other biological agents. and excuse me 1 second. There we go. Sorry, someone was calling me. So my screen went blank. And then the other one is the Z20.828. That is the contact or exposure to other viral communicable diseases.
Excellent. Thank you for that, guys. Just briefly, no one knows how long the window will be for COVID diagnostic testing. We don't know if it's going to go through the summer. We don't know if it'll go through the fall or even into 2021. But we are pretty confident that there's a test protocol that's coming behind the diagnosis or the diagnostics test, and that has to do with antibody testing. Can you briefly tell the group what plans you're putting in place to be available for robust antibody reserve test capacity at Mako?
Yes, sir. And I'm glad you asked that question, Alan. So essentially right now, Mako is doing the IgG antibody test, and we're utilizing a couple different platforms. We're using an Abbott assay as well as a DiaSorin assay for that. There is a lot of assays out there right now that, have essentially been approved, if you will. And the data is scarce. Typically takes 18 to 24 months for, an antibody test to have the complete data and science behind it. So we feel as the weeks go by, especially over the next month or two, the data is going to really be there. Right now, you're basically just getting the positive or a negative in your report. You're not getting any type of values like you would typically see like on a hepatitis panel or anything of that sort when you're running the antibody test. So currently right now, we're doing about 500 to 1,000 a day. This Monday, we will be ramped up to 10,000 a day per day. And it's just a normal blood draw in a gold top tube. It's just a chemistry analyzer that's actually running that test. And essentially here in probably 2.5 to 3 weeks, we will be at 20,000 a day. So we're going to have about 5 instruments running that 24/7 as well. We do potentially see, and we're doing a lot with health departments all over the state and multiple states. And what we're starting to see now is that a lot of the first responders on their frontline workers, they want to do a COVID-19 test and an antibody test at the same time. Essentially, hey, do you have COVID, or, did you used to have COVID? So we are starting to see that. We had some inquiries today about them doing stuff on some of the local ambulance workers in a county in West Virginia. So we do foresee that might be the new norm in a couple months. So it's important to start maybe trying to utilize that as well.
Okay, thanks, guys. And the question just came in the chat box that I think you may have just covered. Can you provide information on the antibody test that you offer? We've had a couple of new folks join just in the last 90 seconds, so that may be from one of those. So specifically, we began the meeting with the diagnostic test, COVID diagnostic test, and the capacity that's reserved for Kentucky hospitals of 5,000 tests a day. But then more specifically, you were just now talking about the antibody test. Can you just clarify that so everyone understands the difference?
Yeah, so essentially the COVID-19 test, the antigen, is ran on PCR. So it's ran on a 12K PCR instrument, Thermo Fisher, and essentially the antibody, that's going to be ran on a wide variety of different instruments. It's just a chemistry analyzer. So essentially we have the Abbott assay as well as the DiaSorin assay currently that we are working on ramping up. We're running both of those right now, and by this time next week, we'll probably be at 10,000 a day, and in 2 to 3 weeks, we'll be about 20,000 a day. So with the antibody test, there's very scarce data available. I know that some other companies, they have the IgG, they have the IgM, but right now, Mako is comfortable with the IgG. Abbott as well as DiaSorin are extremely reputable companies, and we feel that the assays that they have presented to the FDA to move forward with the Emergency Act, the EUA, for these tests, we feel pretty confident in the information that they have provided, and that's why Mako at this time has taken on both of those assays in-house.
Excellent. All right, we're winding up. I don't see any additional questions, just a couple of house cleaning items. If you have joined late, the call is being recorded, and we will share the link in our daily update newsletter. That's the KHA COVID blog update that comes every afternoon to hospital leaders all across the state of Kentucky. And so the recording link will be published and sent out today in the COVID blog from KHA. Please be looking for that. And then you can send this recording link to anybody on your hospital team that needs to hear these details. And then we just encourage everyone to reach out to Ryan and the phone number 304-261-0072. That's 304-261-0072. Or rnibert, R-N-I-B-E-R-T, Nibert, rnibert at makomedical.com. And Mako is M-A-K-O. rnibert at makomedical.com. So please reach out, either send your legal language for laboratory agreement to Ryan, or ask for the Mako version of that agreement for your review. And then I have one more message. Deb saying, or email D Campbell, DCAMPBELL at KYHA.com. Deb, would you like to close us out today?
Sure. I was just aware that some folks do not get that update every day. We are happy for them to get it, though. If anybody wants to get it, let me know that too. But if someone would like this recording or have questions that are, not directly related that you would call Ryan or Jonathan for, I'm happy to try to help you with any of that. And I'm sure Pam and Alan are as well. But I wanted to provide my email address to anyone who doesn't have it there. And we really appreciate you all coming on, Ryan and Jonathan, and talking to us about this. And I really anticipate this being very useful for our hospitals to meet this turnaround time, so that we can make sure our patients and our staff are safe, because we know the status of folks coming in for these procedures. So thank you very much. And I'm sure Alan would like to say goodbye as well and thank everyone.
Yeah, thank you everyone for joining. We may do this again later this week or next week as we have the need come up. And there may be other target audiences. We may want to be talking to the finance people as well, so they understand the financial mechanism. There may be supply chain ramifications where the materials managers want to hear the details and be able to ask questions. So we're planning for all of those types of things in the way of just communicating clearly what the opportunity is that Kentucky's hospitals have, and we want to get our hospitals back up to full service. And we want our communities to get back to work so Kentucky can move forward. Thank you for everyone that's on this call for all of the work that you do every day, committing your lives, essentially your lives, to patient care. God bless you, and thank you for being with us today.
Thank you all.